So the opportunity that this Act gives us is an opportunity to do things differently. And it's something that everyone welcomes. You know, all the social workers we're working with, all the local authorities, although they have to dig deep to make this change, they welcome the opportunity to do it. Because people do feel that they've got overly curtailed in their practice by the processes that have limited the engagement with human beings. Over the last 18 months, and as I say, my background is in social work across a wide range, child protection, adult services, mental health, older persons, a wide range of provision. But the last 2 years I've been working alongside Social Care Wales on their improvement agenda, helping local authorities think about not just what does the Act say, but if we manage to change in line with the Act, what does our work look like? We've got to have a sense not only of the vision, but also how we affect the work. So we've worked with every local authority, adults and children's services across Wales, and they are working together to try and bring about a change. So we'll be very interested to hear if you've noticed a different quality in the care plans you're getting, a different kind of conversation. Maybe not, but if you have, it'd be good to hear. One of the things, as I've already said, is that government, heads of service, gradually politicians at every level recognizing that we have become overly prescriptive in our style and approach. You know, an assessment document now for a social worker has become so comprehensive that they end up having the wrong kind of conversation with people right from the very beginning, asking them all kinds of information that isn't relevant to the person they're talking to, isn't helpful in building trust and in the system. So thinking about all of that is an important part of the shift. You know, if I was waiting at home for someone to come out and assess me, whatever the situation I was in, that would make me nervous. If I was going to be assessed, I could fail. And if I failed the assessment, what would that mean to me? If they didn't give me a service or they did something to me I didn't want? So right from the very beginning, we've created a kind of discomfort. And many of our service users go through one assessment after another, don't they? To try and get to a service. So much of that has to be changed, and many authorities are trying not to use the word now when they're talking to their public, and that's probably something that's close to your hearts as well. The other thing about those conversations is they've been very driven by trying to ascertain whether someone hits a criteria or a threshold or is allowed a service. Now, what that has done over time is ensure that people have very negative conversations. All the conversations have been about the deficits and what people can't do, so that the social worker could go back to the base and crash this case through the thresholds of the panel to ensure they get a service. What that leaves in terms of our service user is a feeling of just having one conversation after another about what they can't do. It's a demoralizing process. So when we start talking to local authorities about bringing back a more strengths-based approach, lots of things have to change. How they capture the information, what they think is important, how they make decisions about allocation of provision and everything has to change. So they're digging deep and trying to ensure that the system is complying with the spirit of the Act at every level. So what they're trying to move to is ensuring that every worker, every skilled worker across Wales has the opportunity to engage in those empowering conversations with people. Uniting all of us in the fact that we're dealing with people who are facing challenging situations, and that we have to have sensitive conversations with people to enable them to start to make sense of what's going on for them in their lives. So collaborative conversations across the piece is what we're trying to encourage. So you may be noticing a change in the care plans. You may be noticing and starting to see more outcome-focused care plans coming through to you. You may be noticing the more strengths-based assessment. So you're getting a bigger picture of a person, their life, their history, what they can do as well as what they can't do. So your starting point is much more balanced and more open. that a feeling like we're in it together, that we can make a collaborative communication around the service user to the outcome. That means flexible conversations. It doesn't mean receiving a care plan with minimal instructions about tasks and then a review of that 6 months down the line, checking whether the service is still happening. Reviews should be changing in their feel. It shouldn't be about reviewing the service, it should be about reviewing the person and their hopes and aspirations. A real opportunity for providers to say, things are different than they were when we met this person, and we need to be taking that on board. So that kind of listening conversation, regularly communicating together and working together, a shared understanding of what all our work is leading to for the service user. So what the Act asks of us, asks of workers, is to ascertain and have regard to people's views and wishes. We don't find out what people's views and wishes are unless we have sensitive conversations where we're listening hard to what's going on. One of the things that's captured people around the country is this concept of what matters. Has everybody heard that phrase, what matters to people? And in some areas that's been interpreted very literally. So into their early conversations, they put a question, what matters to you? The whole concept of what matters needs to be a principle that underpins our work, not a question that we ask people. Sorry, Andrew, knocking my mic. If I was walking down the street today and someone stopped me and asked me what matters to me, I'd struggle to answer that question. So unless I'm in a sensitively guided conversation, I won't get to be able to articulate that or even think about what things are going on that matter to me. But we've had some interpretations where social workers have had referrals from hospitals saying, oh, I've had the what matters conversation, it's a walk-in shower. End of conversation. So we need to get to a process of much more flexible understanding of what trying to get to the important things for people actually means. And that means thinking about how people ascertain views, wishes, and feelings. And from that ascertaining of those feelings, we can get to people beginning to articulate what an outcome would be. Similarly, if I said, what's your outcome? Wouldn't even know what anybody meant. So that emerges out of our conversations with people.